Physiowebseries Knee Complex Season 1. Let's begin with Series 5. In Series 5, continuing with the biomechanics part, we will be discussing about the patella, the facts of patella. So patella acts as anatomical pulley. Here in this diagram, we can see there is quadriceps femoris muscle, the quadriceps tendon, patella, patellar tendon, inserting to tibial tuberosity. So this patella over here will act as anatomical pulley. So patella is not a simple pulley because in a simple pulley the tension at both the sides should be equal. But in this case we can see the tension at the inferior aspect is smaller and the tension at the superior aspect, which is exerted by the quadriceps muscle, is more. So in the center will be the patella, which is the anatomical pulley. Above that superior aspect is quadriceps femoris at the superior side of the patella, which will exert more tension. So in this pulley, the tension of quadriceps, which is at the superior aspect of patella, is more as compared to the inferior aspect of patella. So this is the superior aspect, this is the inferior aspect, and there is unequal tension, hence it is not a simple pulley. So patella acting as anatomical pulley, let's see what it does with quadriceps muscle, giving the quadriceps its advantage but also at a cost. Let's now discuss the advantage of the quadriceps muscle. So patella acting as anatomical pulley lengthens the movement arm of quadriceps. The quadriceps muscle over here by the quadriceps tendon will insert at patella, and then again there will be this patellar tendon inserting at the tibial tuberosity. We have seen this, the same thing in this position, in this diagram, which we previously had looked at, the anatomical pulley, which is the patella. So this will lengthen the movement arm of quadriceps. How it will lengthen the movement arm of quadriceps? By increasing the distance of quadriceps tendon and patellar tendon from the axis of knee joint. So this diagram, if we discuss, here is the patella, this is quadriceps inserting over here, and then patellar tendon inserting over here. So knee joint is somewhere over here at the center. So the patella, which is at the knee joint, has its patellar tendon inserting a little below at the tibial tuberosity. In this way, the movement arm of quadriceps is increased. The movement of arm of quadriceps is increased because of patella by increasing the distance of this quadriceps tendon and patellar tendon from the knee joint. So increase in this movement arm of quadriceps means what? That will increase the rotary component of pull of this quadriceps muscle on tibia. So if we consider this diagram, what this patella does, it increases the movement arm of quadriceps. That means it increases the pull of this quadriceps muscle on tibia, so that the quadriceps can pull this tibia up easily and with more force. So it increases the rotary component of pull of quadriceps on this tibia. So this is very important to understand, that increase in the movement arm of quadriceps muscle means that the rotary component of pull of quadriceps on tibia is increased. That is, the angle of pull will be increased. angle of pull of quadriceps on tibia will be increased, because the quadriceps, if this is quadriceps muscle and this is tibia, here is the tibial tuberosity. So because of patella, the quadriceps tendon, which is inserting over here, again is lengthened little below, away from the axis of knee joint, and hence the quadriceps has its pull on tibia, has its insertion at the end at tibia, because of which it can pull tibia easily with more mechanical efficiency. But there are variations at different angles of knee flexion. This is quadriceps muscle, so there is variation at different angles of knee flexion and extension. So knee extension and flexion at different ranges. Let's see how the patella acts as anatomical pulley. So as we know, patella increases the angle of pull of quads on tibia. So during early stage of knee flexion, as in this diagram we can see, this is the early stage of knee flexion and this is the patella, position of patella. So during early stage of knee flexion, when the patella's position is over here, that patella plays primary role in increasing the quadriceps angle of pull, because now the movement arm for quadriceps muscle, it has started to increase. Slowly as the flexion is going further, the patella is sliding down this way. So during early knee flexion, the patella will increase the quadriceps angle of pull and it will continue to increase it. At semi-flexion, there will be more angle of pull, more movement arm, because the lengthening of movement arm will be done by this patella. So after the semi-flexion of knee, again it will increase, and then after semi-flexion, as the knee flexion is approaching to its end range, so that is full knee flexion. So what happens during full knee flexion? We can appreciate this diagram again, that in full knee flexion, this will be the position of patella and this is the intercondylar notch of femur. Intercondylar notch of femur, where the patella will fit. So as the patella is fixed in this intercondylar notch of femur, this thing will reduce its ability to act as pulley. So this reduces the patella's function as anatomical pulley. So in early knee flexion, it was playing its important role to increase the quadriceps angle of pull. But in full knee flexion, as it gets fixed firmly inside the intercondylar notch of femur, this will reduce its ability to function as a pulley. Again now from full knee flexion, when the extension of knee begins, at that time again this patella will slide from below to above, will start that movement. So the patella over here in this diagram we can appreciate patella over here in the intercondylar notch during knee extension will start moving up and across the femoral condyles. So now it will be here, then it will be here, and finally over here, as can be appreciated over here. In knee flexion it is over here, then it is moving up. So this way it is again increasing or lengthening the movement arm of quadriceps muscle. Why? Because it is leaving the intercondylar notch in which it was fixed in full knee flexion. So it leaves that intercondylar notch and begins to travel up and around the femoral condyles. So in this diagram we can appreciate this is knee flexion and here the extension is taking place. We can appreciate the patella sliding up and around the femoral condyles. So here is the intercondylar notch where this patella is fixed. In knee extension it is going up and hence there is increase in movement arm of the quadriceps. That means the quadriceps pull on tibia will be increased. So in final stages of knee extension also, we discussed about early knee flexion, then late, that is end of the knee flexion. So that was about flexion. Then we started with knee extension, and then end of knee extension, that is the final stage of knee extension. Now in final stages of knee flexion, we saw that patella was fixed in the intercondylar notch of femur. This is the notch of femur and this is the patella. So patella is fixed in the intercondylar notch of femur during full knee flexion, which diminishes its ability to function as pulley. Now it will begin to extend, that is the knee will begin to extend, and again the moment arm of quadriceps will increase, increasing the angle of pull of quads on tibia. And again now there will be an end range of knee extension also. So what happens over here? Again in final stages of knee extension also, patella's effect on this quadriceps movement arm will be diminished or reduced as it is approaching to the end range of knee extension. But in this case, it is slightly different, that in the end range of knee extension also, the patella provides small improvement. There is slight improvement at least. So small improvement in joint torque, the rotary force of quads on tibia. So it provides this small improvement in joint torque, which is most important over here, helping the quadriceps to again pull over tibia to bring about that knee extension. So in final stages of flexion or extension, both ways, we can see the patella's effect or patella's function as anatomical pulley is getting reduced. That too, if compared, we can find that in extension, there is small improvement by the patella in joint torque. However, it is small, then too it plays most important role over here. And in early stages of flexion or extension, the movement arm begins to increase. It keeps on increasing until the end range is approaching. So at that time, the anatomical pulley, which is the patella, is at its best to increase the angle of pull of quads on tibia.